Hello, and welcome back to Healthy Men 70 Plus. I'm Emily Johnson, your health and wellness coach.
And I'm Robert Miller, your senior men's health specialist. Today, we're doing a deep dive into a topic that, well, it doesn't get talked about nearly enough, but it's incredibly important for you guys over 70.
That's right. It's a personal aspect of well-being, something that really impacts health, confidence, and frankly, dignity.
We're digging into insights from Dr. Mohit Khera. He's a board-certified urologist, 30 years of experience in this field. His work forms the basis for our discussion today.
And we want this to be a journey for you toward better understanding. Our goal is practical, valuable insights you can actually use. It's, a common natural part of aging, and it really does deserve an open, comfortable chat.
Exactly. And Dr. Khera points out something really interesting, almost a paradox. He says, while masturbation itself isn't unhealthy, it can actually be good for the prostate, good for circulation, the way most older men do it. Well, it's often working against them.
Quietly causing damage, potentially.
Precisely. So we're going to give you a clear roadmap today. Safe, satisfying self-pleasure after 60. We'll cover the big mistakes to avoid.
And a proven method to sort of reset things.
Yes, and crucially, those warning signs. When you absolutely need to see a doctor.
Okay, let's unpack this then. Diving into Dr. Carr's work, what's maybe the biggest surprise or the core truth he wants men to really get about this after 60? I bet a lot of guys are still playing by old rules.
You absolutely hit it. That's the fundamental thing. The rules change. They just do after 60. And first off, let's be clear. This isn't something for shame. Not at all. Actually, when it's done right, Dr. Khera says it's really beneficial. Helps protect the prostate, keeps blood moving, lowers threat.
It's you connected with your own sexuality, which is important too.
Exactly. It's healthy.
And I imagine that's why he hears that phrase so often in his clinic, right? Doctor, it just doesn't feel the same anymore.
All the time. And his response is key. That's normal. Nothing is broken, but everything is different.
I like that. Nothing is broken, but everything is different. That's reassuring, but also realistic.
It really is. Because your body's different. You've got a gradual decline in testosterone. That's natural. Blood vessels, they lose a bit of that elasticity.
Right.
Nerve signals might take a fraction longer.
Right.
And recovery time after orgasm. It can stretch. Minutes might become hours or even a day or two. That's just physiology.
So the critical point then is ignoring these changes. That's where the trouble starts.
Yeah.
It turns something healthy into something potentially harmful, pain, numbness.
Or even long-term damage, yeah. You ignore the new reality at your peril, really.
It feels like navigating old habits could be tricky.
That's the core issue. And here's where Dr. Khera's observations get really, really interesting and maybe a little sobering, like he said. He sees 3 common mistakes habits, really, that men over 60 often make.
Okay.
And these aren't small things. They quietly chip away at sensitivity, at satisfaction, and ultimately, at your health.
All right, let's get into the first one. Using too much pressure, too much grip strength. That sounds instinctive, doesn't it? If sensation fades, you squeeze harder, go faster, thinking that'll fix it.
It is instinctive, totally understandable. But it's exactly the wrong move. The penis, structurally, it's delicate. You've got erectile chambers, the corpus cavernosum, tiny capillaries, superfine nerves, think silk threads, excessive pressure. It literally flattens those blood vessels. It injures the nerves. Dr. Khera calls it pressure-induced neuropathy. Over time, this can lead to permanent sensitivity loss. Some men find they need such a tight grip to finish. Well, no partner could ever replicate that.
Wow, that's quite a consequence. The idea that you could inadvertently train your body away from partner intimacy.
It happens, so the takeaway is crystal clear. Tighter isn't better. Gentle touch is really the only way to preserve that sensitivity long term.
Okay, so gentle touch. What's the second critical mistake?
Excessive frequency. Dr. Carr hears this often, guys saying proudly, "Doc, I still take care of myself every day, just like always."
Right, like it's a badge of honor proving they're still youthful.
Exactly. But physiologically, that's a problem after 60. Your body just needs more time to recover. The prostate, for instance, it produces a good chunk of your semen, and it simply works slower as you age. Pushing it daily or even multiple times a day
What does that do? Overdrive.
puts it into overdrive, exactly. That can lead to inflammation, swelling, maybe even contribute to BPE, benign prostate enlargement. And beyond the prostate, it can mess with your hormone balance, your testosterone rhythm, leaves you feeling tired, maybe irritable.
Or just not interested in intimacy with a partner, perhaps?
That too. Dr. Carr even talks about ejaculatory fatigue. Orgasms become weaker, less satisfying, more draining than restoring. It's a depletion.
So for men used to a higher frequency, this is a big adjustment. What's the ideal rhythm then, according to Dr. Khera?
For most men over 60, he suggests every 2 to 3 days. That seems to be the sweet spot. Gives the prostate time to replenish, lets the nervous system reset.
Quality over quantity, really.
Precisely. Now, mistake number 3. This is one guys often laugh off, think it's trivial, until it isn't. Neglecting lubrication.
Lubrication. Yeah, I can see how that might seem like a minor detail, but the
That's right.
consequences aren't minor, are they?
Not at all. As testosterone dips, that natural pre-ejaculate fluid, it often decreases, sometimes disappears completely, plus the skin itself gets thinner, more vulnerable.
So dry friction on thinner, aging skin. What's the outcome?
Microscopic tears. You can't see them, but bacteria love them. This leads to inflammation, infections like balanitis, sometimes even permanent scarring that reduces sensitivity for good. Dr. Khera mentions men describing a burning sensation during intimacy and tracing it back years later to simply not using lube.
Wow. Okay, so his advice is pretty stark then.
Very. He says lubricant after 60 is not optional, it's medicine. Simple, water-based, unscented stuff. It's preventative care.
Medicine, that's a powerful way to put it. Puts it in a whole new light.
And you see how these 3 things connect, right? Less sensation leads to more pressure. More pressure causes damage, reducing sensation more. Frequent ejaculation drains you. No lube damages the skin and nerves. It's a downward spiral.
A cycle of decline.
Yeah. But the key thing Dr. Khera emphasizes, and this is so important, it's entirely preventable. You just need the right approach.
Which brings us to the solution. So what does this all mean for you, the listener? How do you turn this around? Dr. Khera developed a system, didn't he? The CARE protocol.
That's right. C-A-R-E. It's a clear, step-by-step way to, well, transform things.
Yeah.
Protect your health, preserve your ability to enjoy intimacy.
Okay, let's break it down. C is for
Cleanliness and comfort. Treat this as something respectful, not rushed, not hidden, not done uncomfortably. Simple things. Wash your hands. Find a private space. And crucially, choose a comfortable position. Lying on your side, maybe reclining comfortably. Not perched awkwardly on a hard chair, which can compress nerves.
Right. Setting the stage. It signals safety to your body, doesn't it? Allows blood flow, natural arousal.
Exactly. It lets the body relax into it. Then comes A, appropriate technique.
Which means moving away from that fast, forceful friction we talked about.
Yes. Gentler, more intentional. And the absolute first step here, lubrication. Always apply it first. Dr. Khera stresses, it's not an accessory, it's essential.
Okay. Lube first. Then what?
Light pressure. Be patient. Sensation might take longer to build. Let it happen. Vary your grip, switch hands. Feel of it more like a massage, maybe. Not just mechanical motion.
And this gentler approach protects the body how?
It prevents that strain, that repetitive trauma that dulls the nerves. It nourishes the nerves and vessels rather than, well, abusing them.
Makes sense. So C for cleanliness and comfort, A for appropriate technique, R is for
Respect timing and recovery. Rushing is the enemy here.
Yeah, you mentioned that. Give yourself time.
Give yourself 15, 20 minutes. Let arousal build naturally, maybe in waves. Don't force the orgasm quickly. And just as vital, honor the recovery time. That 48 to 72 hours between sessions, that's ideal for most men over 60. Let your body fully replenish.
So what you might lose in frequency, you potentially gain in depth and satisfaction. A more mindful experience.
Absolutely. More intensity, deeper satisfaction. And finally, evaluate constantly.
Okay, what does that involve? Paying attention?
Paying close attention. How does your body feel during the act? How does it feel after? This is the part many men skip.
And what should you be looking out for specifically?
Any pain that lingers, numbness, swelling, any unusual discharge. These aren't just little annoyances, Dr. Khera says. They're signals. Your body talking to you.
Listen to the signals.
And listen early. It can prevent permanent damage. The whole CARE protocol, really it's more than steps. It's a mindset shift. Respecting your changing body. Replacing potential shame with intention, damage with healing.
That's a great framework. But even using CARE, it's still important to know when something needs medical attention, right?
Yeah.
What are those specific red flags?
Absolutely crucial. Because sometimes, despite best practices, things can still go wrong, or underlying issues might surface. And too many men, as Dr. Khera sees, they wait. They ignore things.
They put up with pain, maybe dismiss a little bleeding.
Exactly. Until it becomes a crisis. I want you to avoid that. Knowing when to pick up the phone and call your doctor is vital.
Okay, let's list those critical warning signs. What's number 1?
First, pain that lingers or gets worse after masturbation, especially sharp, burning, or throbbing pain lasting more than, say, half an hour. Could be nerve irritation, vascular strain, maybe prostate inflammation. Don't ignore persistent pain.
Okay. Lingering pain. What's next?
Second, sudden numbness or tingling that doesn't go away quickly. Or if sensation just disappears or changes dramatically, that could signal nerve compression, maybe early neuropathy.
Got it. Numbness or tingling. Third.
Visible changes, any swelling, weird discoloration, new bumps you haven't seen before, or any discharge, particularly if it's yellow, green, or smells bad. Strong signs of infection. Needs checking out.
Right. Visible changes or discharge. Fourth sign.
Urinary issues right after self-pleasure. Trouble starting urination, a weaker stream than usual, burning when you pee, or needing to go much more often. Could be prostate or urinary tract inflammation.
Okay. Urinary changes. Fifth.
Fifth, and this is non-negotiable, any bleeding. Doesn't matter how minor it seems. A tiny streak. Anything. It needs immediate medical evaluation because it can signal something much more serious.
Any bleeding at all. That's clear. And the sixth warning sign.
Sixth, persistent changes in your erectile function. If you find you consistently can't get an erection during masturbation when you used to be able to,
Yeah.
that's a flag.
Yeah.
It could point to early circulation problems, maybe even underlying cardiovascular disease.
That's a big one. The connection between erectile function and heart health.
It really is. The penis is often like the body's canary in the coal mine for vascular health. Ignoring changes there could mean ignoring your heart.
And the key message here is, don't hesitate to talk to your doctor because of embarrassment.
Please don't. Medical professionals like Dr. Khera, we've seen it all, truly. What feels awkward to you is just a medical symptom to us. Speaking up sooner is always better. Prevents small issues from becoming big ones.
Okay. That's really important practical advice. Now, let's shift a bit. We've talked a lot about the physical mechanics, the do's and don'ts. But why does this conversation matter on a deeper emotional level for your overall sense of self?
That's such a vital part of this. Because the physical and emotional are deeply connected, aren't they? Dr. Khera hears about the embarrassment, the guilt some men feel.
Or that fear, maybe, that getting older means you're just supposed to shut down that part of yourself, hiding it.
Yes, exactly. Hiding it from partners, from family, carrying the sense of shame. It's a heavy weight. And Dr. Khera's message, loud and clear, is there's nothing shameful about this. Self-pleasure at your age is not weakness. It's not selfishness. It's a sign your body is still alive, still capable of connection, still worthy of care. It's a fundamental human need.
And he sees positive changes in men who embrace this safely and respectfully, doesn't he? More confidence.
Definitely. More confidence, often better sleep, more energy. They seem to approach relationships with more openness, too. It's like lifting that burden of shame allows everything else to flourish.
It's a holistic effect.
It really is. It's not about trying to perform like you did at 30. It's about honoring the man you are today. Pleasure evolves. It deepens. It carries wisdom. That's something to embrace, not run from.
That's a beautiful way to put it. Pleasure evolves. And that silence breeds shame. That really resonates. Talking about this, learning, practicing safely, it's an act of self-respect.
An act of courage, even. It shows you value your health, your dignity.
A powerful thought indeed.
So as we wrap up this deep dive, the core message, drawing from Dr. Khera's wisdom, is this. How you approach self-pleasure after 60 makes all the difference. It can be a slow erosion, or it can be a tool for healing, for strength, for peace. The choice is yours.
Treat your body gently. Listen closely to its signals, and please never, ever be afraid to ask for help if something doesn't feel right. You absolutely deserve to age not just with time, but with dignity, with vitality.
And with that quiet satisfaction of knowing you're taking care of yourself wholly.
We really hope this deep dive has given you some valuable insights, some practical steps you can take starting today for a healthier, more confident life.
Your well-being is genuinely our priority here at Healthy Men 70+.
Yeah.
If you found this discussion helpful, maybe give it a like. Share it with someone else who might benefit.
And do subscribe to Healthy Men 70+ so you don't miss out on our future deep dives and guidance.
Thank you so much for joining us today.
We'll see you next time.